So, hello everyone. Welcome to our YouTube channel today. Today we'll be covering the histological organization of the urinary system, and your presenter is Kimani. Once again, our topic of discussion today will be talking about the histology of the various parts of the urinary system, and that is the scope of our session today. We'll try to review the adrenal gland. We'll also try to talk about the histological organization of the kidney. Then we'll talk about the organization of the ureter, the organization of the bladder, and then finalize with the urethra. So they are the components of the urinary system. We can appreciate we have two kidneys there, and then we have two ureters, the urinary bladder, and then that's the urethra. So we can see how the two kidneys are receiving their blood supply from the abdominal aorta and also draining into the inferior vena cava. And these are the ureters having the three constrictions there. And then you can see you have one bladder and then one urethra. So in terms of recapping the histological organization of the adrenal gland, we all know it has a cortex, and this cortex has the three layers. So zona glomerulosa, zona fasciculata, and zona reticularis. So GFR, zona glomerulosa, zona fasciculata, and zona reticularis. And then, despite the adrenal gland having the cortex, it will also have a medulla. And this medulla produces the catecholamines. So it has a cortex and a medulla, as we talked about. Then the cortex has three layers: zona glomerulosa, zona fasciculata, and zona reticularis. So these three layers produce hormones. So zona glomerulosa produces mineralocorticoids, the most important one being aldosterone. Then you have zona fasciculata producing glucocorticoids, the most important one being the cortisol. Then you have zona reticularis, which produces androgens. Yes, so with that, you can be able to think that you have aldosterone, salt retaining, then you have cortisol, glucose, and then androgens, so sex hormones. So the acronym could be the deeper you go. So the deeper you go, the sweeter it becomes. So from the salt retaining, which is not that sweet, and then androgens relate to sex. Yes. So there we have zona glomerulosa, mineralocorticoids, fasciculata, glucocorticoids, and then zona reticularis. Here you have gonadocorticosteroids, starting with now dihydroepiandrostenedione, and then the rest are there. So here we can see the layers histologically: zona glomerulosa, fasciculata, and reticularis. And then there's a medulla with this central adrenomedullary vein. You can see it here. So this is adrenal medulla with the blood vessels, the largest one being this one here, the central adrenomedullary vein. For the medulla, it has cell types, and then you'll be able to appreciate the hormones secreted are catecholamines. So the adrenaline or noradrenaline. So we can appreciate these are hormones which act as neurotransmitters. And then you have cell types being chromaffin cells, so which are modified postganglionic cells. So chromaffin cells which come from neurocrest cells. So this adrenal medulla, given it has chromaffin cells which are modified postganglionic cells of the sympathetic system, they'll be regulated by the sympathetic nervous system, which ideally targets most parts of the most organs, most viscera. So eyes, heart, blood vessels, respiratory system, digestive system. So remember, this sympathetic system is one that is in charge of fight or flight mode. So ideally, the eyes will dilate, you'll have increased heart rate, blood vessels will dilate, respiratory system will increase, you'll have tachypnea, digestive systems will have inhibition of the digestion. Yeah, so that is how now these catecholamines will act. Then you go to the kidney. Of course, at this point, the kidney is paired. It's kidney shaped. Then it's located in the abdomen. Then you're supposed to know the structures at the renal hilum, starting with VAP, that is the vein, the artery, then the pelvis, from anterior to posterior. Then you're supposed to know the relations of the kidneys for the exam purposes. So at one time, maybe you can look at the relations of the kidney. So what are the functions of this kidney of ours? So here we can see a very good image showing us the structure of a nephron, and that tells us something to do with excretion. And then body hemostasis, that in terms of conserving electrolytes and fluids. Then endocrine functions in terms of production of erythropoietin for erythropoiesis, renin, which is in the RAS system, the renin angiotensin aldosterone system. Then you have production of vitamin D3. So those are the endocrine functions. And then, so these are kidney that you're talking about. Kidneys, ureters, the bladder there. If you can have now a cross-section of this, a longitudinal cross-section of this, can be able to appreciate that we have the cortex. There you have the cortex. Then the medulla will contain the renal pyramids and the renal medulla. So the renal medulla are just extensions of the cortex into the medulla. Then these pyramids will empty using the renal papilla to the minor calyxes. Then the minor calyxes join to drain into the major calyxes. And then the major calyxes will drain into the renal pelvis. Then from the renal pelvis, we'll have the ureter. Yes, so that's how that drainage happens. So what are the functions of this kidney of ours? We can appreciate it will have a couple of functions. So excretion, in terms of excretion of metabolic waste products and foreign chemicals. That's function number one. Function number two, remember we talked about regulation of water, that is homeostasis, and that is body fluid and electrolyte. So that maintenance is done by the kidney. And then regulation of blood pressure. So we'll have the narrowing of the renal artery and even of the arterioles will tell us the blood pressure. Then it aids in acid-base balance, aids in gluconeogenesis, helps in metabolism and secretion of hormones. We talked about vitamin D3, we talked about erythropoietin, we talked about renin, and then also it is involved in endocrine function. So those, the renin angiotensin aldosterone system, erythropoietin, and vitamin D3. Okay, so what is the histological organization of the kidney? We've talked about this. So let's try to appreciate its histological organization. So it has a stroma and a parenchyma. So the stroma is a connective tissue. Then the parenchyma is now the cortex and the medulla. So the stroma has a renal capsule covering the whole of the kidney. So the renal capsule, it will be dense connective tissue. So this capsule that you're seeing here is a dense connective tissue, and then it will be bilayered. Dense connective tissue, and it will be bilayered. That is, it has an outer fibrous part and an inner cellular part. That is the reason why it's bilayered. Then this renal stroma will be sending in interstitial stroma, interstitial trabeculae now, which are loose connective tissue, and they are highly vascularized as this capsule is. So it will be appreciated that we'll be having some interstitial stroma that will be vascularized, separating this cortex and medulla into the various parts. Then located between the nephron components and around blood vessels and the renal pelvis. So even this part containing fat will be containing the interstitial stroma, then contains adipose tissue around the renal pelvis, as you can see here. Okay, then for the parenchyma bit now, this one will contain epithelial lining. Why? Because it will be containing the nephrons and the tubules, the collecting ducts. So that's the reason why it's epithelium, and the epithelium will be simple cuboidal. So divided into outer cortex and inner medulla. So this is the outer cortex and the inner medulla. So the medulla are these pyramid shaped, and these renal pyramids and the columns. So let's talk about the kidney parenchyma once again now. It has a renal cortex. We talked about renal cortex and a medulla. So the renal cortex is only be containing renal corpuscles. That's the most important thing. And this renal corpuscles is being formed by the Bowman's capsule and the glomerulus. And then we can have an extension of the cortex into the medulla being called the renal column. So here are the renal columns. So you can see this is a cortex that is extending into the medulla. Cortex extending into the medulla. Cortex extending into the medulla here. Then the remaining part will be now the renal medulla. So this renal medulla is the region lacking renal corpuscles because the renal corpuscles are found in the renal cortex. In addition to that, this renal medulla has loops of Henle at different lengths, and they have collecting ducts. So let's not forget that this renal medulla will contain the pyramids and the columns, as we had alluded earlier. Then what will you be able to see that you can be able to determine this is the renal medulla? You'll be able to see the medullary rays, which penetrate the cortex from the base of each pyramid. So those are the medullary rays that you'll be able to see in the renal medulla. Then we'll have the renal pelvis, which now will be connecting the nephrons to the ureter draining each kidney. So the calyxes, the pelvic calyceal system, comprising of the calyxes, major calyxes, minor calyxes, the pelvis and the ureter, will form the pelvic calyceal system. And then now the collecting ducts in a lobe empty into the minor calyx, on which these minor calyxes are found on the renal papilla. So for example, here's a minor calyx being draining the renal papilla. So this is a renal papilla here. The renal papilla draining into the minor calyx. And then the minor calyx will drain into the major calyx. The major calyx will drain into the renal pelvis. Then from the renal pelvis to the ureter. Yes, that is a pelvo-calyceal system. So you need to look at the structure of the nephron. So we talked about this pelvic calyceal system being there. Can appreciate the cortex and then the medulla, the extension of the cortex, the renal columns. So if we can magnify now the structure of the nephron, remember the nephron is a functional unit of the kidney. It will have the renal corpuscles comprising of the Bowman's capsule and the glomerulus. The tuft of capillary is known as glomerulus. You'll have proximal convoluted tubule, then thick descending loop of Henle, loop of Henle, thin limb, then you have the thick ascending limb, you'll have distal convoluted tubule, and then after that now you'll have the collecting tubules and then the collecting ducts, which open into the papilla, the renal papilla there. So that's the structure of the nephron. So on this nephron of ours, you're supposed to appreciate it has various parts of which you've seen them. We have two types of nephrons. Talked about it being the functional unit of the kidney, so that's okay. Two types of nephrons. Ideally, you have three. Both participate in the urine formation. So we have cortical. You can see it's majorly found on the cortex. With the cortex, the medulla. So the cortical ones are majorly found on the cortex. Then the juxta medullary nephrons, they are loop of Henle, very long loop of Henles, and then they are located. The loop of Henle is located in the medulla. So the juxtamedullary nephrons, they have very long loop of Henleys, as you can see here. Very long loop of Henleys. They are surrounded by vasa recta. And that's the reason why they can be able to establish hypertonic environment in the medulla and actually produce hypertonic urine. While the cortical nephrons, at this point, they are just found on the cortex. They won't produce as hypertonic urine as this vasa recta. Yeah, but these vasa recta which are surrounding these juxtamedullary nephrons. Then you'll have now the intermediate nephrons being found in between the juxtamedullary nephrons and the cortical nephrons. So you need to talk about the microcirculation of the kidney. So the blood is coming from the abdominal aorta. So this is the abdominal aorta, from the abdominal aorta to the renal arteries. So blood from the aorta goes to the renal arteries. From the renal arteries, we'll have segmental branches. So you can appreciate you have segmental branches. From the segmental branches, we'll go to arcuate branches. So here, you can be able to appreciate the arcuate branches, is how it's arcing. How it's arcing. You can appreciate the arcs of the arcuate arteries. So they are arcing, arcuate arteries. So from segmental arteries, before you go to the arcuate arteries, you'll have interlobar arteries. So here you have a segmental artery. For example, this is a segmental artery. Then you go to this interlobar. So this segmental divides into interlobar. Then from the interlobar, we'll have arcuate, which is arcing here. So you can see how now this interlobar is dividing into two arcuate arteries. The two arcuate arteries, they arc. Then from the arcuate arteries, you'll have cortical radiate arteries. So these cortical radiate arteries, they now go into the cortex, as you can see there. Then from the cortical radiate arteries, you can form capillaries. So the capillaries at this point will be afferent arteriole, which enters the Bowman's capsule to form the tuft of capillaries known as glomerulus. Then the glomerulus leave the Bowman's capsules as efferent arteriole, of which now they can form the peritubular capillaries or the vasa recta. And then these peritubular capillaries or the vasa recta, they can drain into the cortical radiate vein and the arcuate veins. So at this point, now we have the corticoradiate arteries and the corticoradiate veins. These corticoradiate veins will drain into arcuate veins, from the arcuate veins to interlobar veins, from the interlobar veins to segmental veins, from the segmental veins into the renal vein, and then inferior vena cava. So kindly take note of this kidney microcirculation. It can easily come to the exam. Okay, so we need to talk about the blood supply around the nephron. So the peritubular capillaries will be surrounding proximal convoluted tubule and distal convoluted tubule. So you can see here. So this surrounding this proximal convoluted tubule and distal convoluted tubule will be our peritubular capillaries. They just allow absorption of substances into the blood. So solutes and water, glucose, and the rest of the structures will be absorbed by the peritubular capillaries. Then the other one will be the vasa recta. So you can see the vasa recta here. So these are a set of parallel arterioles and venues that supply and drain the capillary plexus surrounding the loops of Henle. So these are vasa recta. So their function ideally is to be able to do the function of osmoregulation and create that hypertonic urine. Yes, so let's talk about filtration barrier. For the filtration barrier, we are supposed to know the layers of the filtration barrier, starting from this end, or maybe if you can have this cross section here. So this one will help us to understand where we are, this image on our right. First of all, you can appreciate we have a Bowman's capsule here. And then this Bowman's capsule, it has glomerulus. So in the glomerulus, it will be lined by the podocytes. So you can see these podocytes, they are having food processes. So podocytes and their food processes. And then from there, we have this basement membrane containing of the lamina rara, lamina densa. And then you can be able to appreciate, you have the capillary. So it's endothelium and its basement membrane in that regard. And the capillary has simple squamous epithelium. So those are actually the layers of the filtration barrier. So these are longitudinal cross-section. A transverse cross-section. So, but in between, before you go to the food process, I usually have a glycocalyx layer. So from the glycocalyx layer, you go to capillary endothelium. Then from the capillary endothelium, you go to the basement membrane. From the basement membrane, you go to the podocyte food processes, which have slit diaphragms, as you can see there. So here, before you go to the lining of the capillary, you have the glycocalyx, then you go to capillary endothelium, then you go to the membrane, then you go to basement membrane that you've seen there, and then the food processes. So those are the layers. So glycocalyx, capillary endothelium, basement membrane, and the podocytes. So ideally, if you want the process of filtration to happen, it starts from here, from the point where you have the capillaries, the glycocalyx, capillaries, all the substances that will undergo the process of filtration will pass through those layers. Yes. And then we have the juxtaglomerular apparatus. So the juxtaglomerular apparatus are actually the structures that are found just on the vascular pole of the renal corpuscle. So remember, this Bowman's capsule and the renal corpuscles anteriorly, or just at this point, we'll have this is a vascular pole. Then on the other end, we'll have the urinary pole. So it will have three cell types. It will have macular denser cells. So the macular denser cells are these cells here. So these macular denser cells enable the monitoring of the osmotic concentrations of the tubules contents. So they enable these tubules that are found here to be monitored. So that's the function of the macular denser cells. And then we'll have the juxtaglomerular cells. So these are the juxtaglomerular cells here of the afferent arterioles. So they secrete renin from the response they get from the macular denser cells. And due to that, now they can be able to change the stretch, and that's how actually you can be able to regulate the blood pressure. The other cell types will be these lacy cells, or the extra mesangial cells. So these are the cells that now at this point, they'll be found in between. So these are the macular and the mesangial cells. The extra mesangial cells are the lacy cells located between the juxtaglomerular cells and the macular denser cells. So the functions of these mesangial cells, they just enable the communication between the macular denser cells and the juxtaglomerular cells to be possible. So they enable transmission of the signals between macular denser cells and the juxtaglomerular cells. And then these mesangial cells now, remember you have extra glomerular mesangial cells and then intra mesangial cells. So these ones will be located in the glomerular capillaries between the glomerulus and the juxtaglomerular apparatus. Yeah, so lacy cells are different cells, and then you have intramesangial cells in that regard. And then these mesangial cells, they'll have a phagocytic function to clean the basement membrane in terms of the slits, the diaphragmatic slits. And here now you can be able to appreciate the layers of the filtration barrier. So from the urinary space, we can be able to appreciate you have the podocytes, these are basement membrane, these are the food processes, these are the capillary endothelium. So at this point, we'll be having blood. and then here you'll be having urine. So these are the layers. Okay, in a nutshell, this is what you're trying to talk about. We have the renal papillae. These renal papillae at this point will be draining. We'll have the collecting ducts draining into them. Then you have the renal pelvis. Then is a adipose tissue. Is a connective tissue. Okay, so we go to the ureters. You're supposed to know the blood supply of the ureters. This is it, the blood supply of the ureters, starting from the renal arteries, gonadal arteries, abdominal aortas, common iliac, internal iliac, vaginal arteries, and the middle rectal. So all those branches that supply the ureters, you're supposed to know them. And then the three constrictions, pelviureteric junction, at the pelvic brim, and at the entry, at the intrauterovesical junction as it enters the bladder. Then the last one now is this one. Now this one is regarding the layers. So the layers and the relations. So at this point, the most important one is now the water under the bridge. So water is being carried by, water is now the urine being carried by the ureter, and then you'll be having the bridge being the testicular arteries or the gonadal arteries. So this is the same. You're supposed to appreciate the blood supply. You're supposed to appreciate the drainage, the lymphatic drainage on both. So at our own time, kindly let's make sure we go through that. And then let's talk about the histology of the ureters. This one is important. So remember, just like any other layer, it will have a mucosal layer. And then this mucosal layer will be containing a transitional epithelium. And this transitional epithelium will be stratified. It will have stratification. So mucosa having transitional epithelium, and then it will also have a lamina propria. So this is a mucosa containing of transitional epithelium and the lamina propria. Yeah. Then from there, it will also have a muscularis externa with 3 layers, 2 to 3 layers of the smooth muscle, but most of the times 3 layers. We'll have inner longitudinal, middle circular, and outer longitudinal, as you can see the layers here. So here, we have inner longitudinal, then middle circular, and then we'll be having an outer longitudinal present only on the distal one. That is a similar case. You can be able to appreciate the transitional epithelium there. This is a lamina propria, and then the muscular layer will be there, containing of the 3 layers. And then you'll have the adventitia stroke serosa. Now the one that will be just adjacent to the adipose connective tissue. So it's a fibroelastic connective tissue with blood vessels and nerves to the ureters, as we talked about it. And now this is what we'll be able to appreciate in our labs. Be able to appreciate this star-shaped lumen. And then, so actually this star-shaped lumen is a characteristic of the ureter. We have, the transitional epithelium, this is a lamina propria, and then the muscles now will be here. These are the muscles. Of course, these muscles are smooth muscles. Then you go to the bladder. You're supposed to appreciate the histological, its gross features. Of course, we know it has the base, it has the trigone, it will have these lateral umbilical vessels, the middle umbilical vessels, and then now we go to the histological bit. But before then, can appreciate it is found on the posterior of the pubic symphysis. Capacity will be varying from 700 to 800, but it's smaller in females. Why? And then the other point is that towards the base, we'll have the ureters draining in, as you can see here. These are the 2 ureters. And then the draining of this draining of the ureters, the ureteral openings, and the opening of the urethra will form a trigone there, as you can see. Okay, so we can be able to appreciate the layers of the bladder. We'll start with the mucosa. This is a mucosa that we'll be talking about, containing now the transitional epithelium, which is stratified squamous. Stratified squamous at this point. So it is stratified squamous if it's stretched, and then it's having a bumpy surface. Stratified cuboidal if it's not stretched. So by all in all, you just call that epithelium transitional epithelium. And then below it will have the lamina propria, of course, containing blood vessels. Below it will be having now the muscularis externa. So this muscularis externa will be now the layers of the detractor muscle, which is a connective. It's a smooth muscle. So blood vessels in this detractor muscle, it will be having 3 layers, as you can see here. So these are the layers of the detractor muscle. So internal, longitudinal, intermediate, or the middle circular, then external, longitudinal. Of course, on the outer bit, we'll be having adventitial serosa, which will be loose to moderate dense connective tissue. So that's the mucosa, the muscularis layer, and then this is the serosa. And that can be well shown on this, can be able to appreciate the transitional epithelium having now these umbrella-shaped cells. So the umbrella cells, these are the bumpy surface which will be having, can be able to appreciate they are binucleated there. Then the stratification can be able to appreciate. So this one is transitional epithelium. Below it, can be able to appreciate this is the lamina propria, the blood vessels are there, and then this is a internal longitudinal muscle of the detractor muscle. Then you go to the urethra. So maybe you can take a screenshot of this. This one is important. You need to know the features between male and female urethra in terms of length. Of course, you know the male will be long. In terms of diameter, you're supposed to know the functions now in males, both urine and semen, parts, preprostatic, prostatic, membranous, and penile part of the urethra in males. Cause, of course, you need to appreciate the cause. External urethral orifice in males is found in the glans penis, in females in the vestibule. Relations, you're supposed to know them. Then the mucosa, this one is important. So mucosa in males, it will have different types of epithelium. So the preprostatic part will have the urothelium. Prostatic part will have urothelium also. The membranous part will have pseudostratified columnar epithelium. We'll have the penile part having pseudostratified epithelium on the inner bit, on the proximal bit. Then as we move now towards the glans penis, we'll have stratified squamous and keratinized epithelium. Then associated glands, of course, you know, prostatic gland, seminal vesicles, urethral glands, and the barbourethral glands, that is the Cowper's glands in males. In females, of course, it will have 2 epithelium. It has 2 parts, pelvic part and the perineal part. The pelvic part will be having pseudostratified columnar. The perineal part will be having stratified squamous, which becomes keratinized deeply, distally. So this one is an important. So kindly at one time, maybe you can have just take a screenshot of this and then go through it at your own time. And that is the reason why now you can be able to appreciate that there. So this is a urethra, can be able to appreciate 3 parts actually should be 4 parts. So preprostatic, prostatic, membranous, and penile stroke the spongy urethra varying with the epithelium as had alluded earlier. Then the mucosa will be varying from transitional, that is the urothelium, to pseudostratified columnar to stratified squamous keratinized epithelium. Then, of course, it will have a lamina propria which will be containing this spongy tissue, the erectile tissue in males. And then you'll have a muscularis externa in females. And then the adventitia in females also, those connective tissue in females. So the same thing now, this one will be in females, can be able to appreciate a very big lumen containing transitional epithelium, then the muscular wall, then the adventitia. So this is the histology of the urethra in females. And then that marks the end of our session today. So we've looked at the urethra, we've looked at the ureter, we've looked at the bladder and the kidneys, and then we've reminded us of ourselves of the histological organization of the kidney and the adrenal gland. So I guess with that, I have nothing else rather than just wishing you all the best in your endeavors, in your medical practice. And just remember, if you can't fly, then run. If you can't run, then walk. If you can't walk, crawl. But in whatever circumstance, always make sure you're keeping moving forward, you're striving forward, and all shall be well. So I guess with that, I'll see you in our next video, and I wish you all the best in your future exams, in your medical practicing, and also as you study to become a better doctor. See you and goodbye.